So I'm Siddhartha Yadav. I'm a medical oncologist at Mayo Clinic. Primarily treat patients with breast and GYN cancer. I've been involved with the foundation for, over 5 years now. And in the role of chair of the Education Academy for the last 4 years or so. So within the Education Academy, one of our main mission is to address disparities in how information about cancer care is delivered throughout the country, here in the United States and globally. And one of the areas that we focus on in this is the challenge with large conferences, as you know, is they have become way too big in many ways. As an academician, I find them interesting and helpful because I go there to learn about new research. But as you can imagine, a lot of oncologists who practice in community don't have that kind of time or the patience to go there and sit through all these conferences to truly understand what's changing in the field. The other challenge also is, in my practice, I just treat breast cancer patients. So I can go to these large conferences and I say, I just want to hear about what is happening in the breast cancer world. A lot of community oncologists do not have that kind of luxury, right? So, they will go there and they have to try to grasp everything that's happening in the entire oncology world. So what a conference like this does is it sort of distills down the key presentations from this large ASCO conference and brings it in a way that is easily, in a format that is easily acceptable to community oncologists so that they can spend a day and a half and learn how to take that information that was presented over 5 days and implement that in their practice. As a conference chair for a conference like this, it is obviously a true honor to be that because, to bring that information from a large conference like ASCO and bring it to community oncologists and to think that this is going to influence patient care as we move forward is obviously a true honor. My experience as a conference chair has been amazing, and with the team, you guys and everybody else has worked wonderfully. I would say I have the least intense work over here. My goal is really to make sure that, I identify speakers, I identify who are the true key leaders in each of these talks and try to bring them over here. And the rest, obviously, from an organizing part, the foundation has taken care of all of that, whether that's venue organization, logistics, all of that, and I have very minimal involvement in that. But identifying the key speakers and trying to bring them over here in itself is rewarding because then, when they are here, I get to talk to them, we get to all meet. So there is obviously the academic side of things where we are talking about the conference, but there is also the social side and the networking side, which is also very exciting. As being a conference chair, I get to talk to all these people, get to know them a little bit better. And these are folks that I have worked, a lot of community oncologists have worked with them in clinical setting. Now knowing them in the social setting is obviously very rewarding as well.